Good afternoon, everyone, and thank you for joining me again as we talk about COVID-19 and our response here in Erie County. Unfortunately, today I have to report we have 4 new confirmed positive cases of COVID-19 in Erie County, bringing us to a total of 46 positives with 1,168 negatives. These new cases are individuals in their 50s, 60s, 80s, and 1 in their late teens. 2 of those we believe are related to travel outside of Erie County and within the United States, and 2 are still under investigation by our county's health department. 2 of these new cases are located in Zone 1, and the other 2 in Zone 2, which you can find on the cumulative cases map by zone at eriecountypa.gov. As always, contact tracing continues by Erie County's Department of Health. I have some good news. As of today, 22 individuals have recovered from their diagnosis of having COVID-19. Regarding the 1 case that was brought up yesterday who lives in a personal care home. Personal care homes are independent, more intimate living, more like a family living type of setting. It's not the same as a nursing home, a rehabilitation center, or what we refer to as senior living center. There are just a handful of residents who share that living space. We believe that that home, that residence, has taken the proper precautions to really eliminate or to stop the spread of COVID-19 within the facility. Contact tracing, as I said, continues and brings us more and more useful information every day. The state numbers today are at 27,735 positive cases and unfortunately 707 deaths. That is 1,245 new cases in the last 24 hours, along with 60 new deaths. Warren County still stands at 1 case, with Crawford County at 16. And Allegheny County has 925 cases and 35 deaths. So let's all continue our physical distancing, our very stringent 20-second hand washing, and wearing our new fashion accessory, our mask. And I'm going to talk a little bit more about masks in just a minute. Our environmental task team, our environmental team has received 20 new complaints and continues to make field inspections to help life-sustaining businesses remain open. So with the new order set by Secretary Levine yesterday, that goes into effect immediately, but enforcement starts Sunday at 8 p.m., we ask all of our businesses to develop a written policy on how you will comply with the order. It's going to take a little time and some planning. So I ask you to please look at this now and in the next few days and decide what your approach is going to be to provide masks for your employees and have everyone in your business wearing them. I also want to ask that all of us consider our proper disposal of any masks or rubber gloves that we might be wearing. Unfortunately, we have seen a number of gloves and masks just laying around as litter. Please take your mask and your gloves with you. For example, if you wear them in a grocery store, take them with you and dispose of them properly when you get back to your own home so that anything that's contaminated would then go into your own garbage and out to the trash. The county will be issuing some guidance through our enforcement task team to the marinas. There have been some questions about marinas and people being able to get their boats in the water and such. Guidance will be hand-delivered to each marina owner regarding this. We have been able to get some clarification from the state around that. We believe that taking all of these precautions that we're talking about, including masks being worn in businesses, is really our first step in getting our economy back up and running, to getting back to work. So these businesses that are open now are going to hopefully be the leaders and help every other business figure out how we do this as we start to go back to some sense of normal. So if you need assistance with mask guidance, how to make them, how to wear them, You can find this information on eriecountypa.gov, at the cdc.gov website, and at health.pa.gov. And just shortly before I came up today, I went onto one of these sites and I found a new mask that we're also talking about. I made this today with a t-shirt and a pair of scissors. No rubber bands, no sewing needed. They have the patterns right on there for children, small adults, medium, large adults. You take this piece of material, you cut it almost like a little boomerang, you cut 2 holes on the other side, you put it over your face, and you twist it around your ears, and voila. This is actually more comfortable than the green one that I've shown you. So very simple to make. All of us can do it with a t-shirt, and I know we all have way too many t-shirts probably in our drawers. So please look at that on our website, eriecountypa.gov. Now, I've had some discussions with President Judge Trisilla regarding masks because we actually, even prior to the governor's order, had determined that we were going to require masks be worn in all county buildings. So I've spoken to him about that and about wearing masks and how that might affect the courts and the courthouse. So tomorrow he's going to be here to provide us some more information about the courts and about masks and some of the things that are happening within the court system. Once again, if you need more information or guidance, go to eriecountypa.gov, call us at 451-6700, or email us at ecdhinfo@eriecountypa.gov. And lastly, thank you for all of those who've helped us to celebrate National Public Safety Telecommunicators Week. Those are our first responders who answer that 911 call. And thank you for sending them a note of thanks at public.safety@eriecountypa.gov. And now we'll hear updates from our hospital partners. And today we would like to start with LECOM Health and Dr. David Rubino. Monsignor David Rubino, I'm sorry. Monsignor Rubino, are you with us?
I am here, Kathy. How are you?
Good.
Thank you so much for the invitation to be here, and thank you for your leadership through this critically difficult period of time. Just a very quick, brief report on our end from Mill Creek and Corey. We've tested about 70-odd some individuals. We are fortunately all right with personal protection gear. The Eleanor, the new facility we opened, is open. It has received a patient or 2. We don't talk numbers, but they are open and operational. And that's really from our end about it. Other than the behavioral health people always remind me to remind ourselves that these are difficult times. And it's important for us to think how we talk, because the language that we use is really important. And it's careful, especially with young children and not so young children, that the language that we use in describing situations is positive. Otherwise, negative language can truly tend in these difficult times to burden us down even more so than we are. So thanks again, Kathy, for the opportunity.
Thank you, Monsignor Rubino. And thank you for that reminder for all of us when it comes to how we speak. Doreen Summers now from the VA hospital is with us. Doreen?
Hi, Kathy. Good afternoon.
Good afternoon.
Here at the Erie VA, we continue to support our veterans using both phone and virtual appointments. In addition to our primary care and behavioral health virtual and phone clinics, we now offer our veterans tele-urgent care. Veterans who are enrolled in VA healthcare can now obtain this care with a video chat or a phone call for issues such as things like minor cuts, rashes, skin irritations, maybe a sprain, or some back or joint pain. Using VA Video Connect and a camera on just your smartphone, computer or tablet, veterans are able to meet privately and securely in a virtual medical room with a licensed independent provider or a physician. Veterans can access this care by calling 1-833-TELE-URGENT, or that's with numbers 1-833-835-3874. Another resource we're offering are social support groups for our senior veterans who are in need of added support or connection during this time. These weekly support groups will begin the week of April 20th and will open to veterans to be joining anytime. They will be available for about 8 weeks. We continue to use our drive-through testing to test for COVID-19, but as a reminder, this testing is by appointment only for veterans who have met the criteria and have a provider order. All of this information, as always, is available on our main website, and we encourage veterans and their families to go to the website and sign up for email updates to receive this information right in their email mailbox. Again, veterans experiencing any cold or flu symptoms or COVID-19 related symptoms should call 814-868-8661 and press 3 for our Ask a Nurse line. The nurse there will provide veterans with appropriate screening and follow-up instructions. And again, thank you for everything, Kathy, and a reminder, we're all in this together. Thanks for having us.
Thank you, Doreen, and thank you especially for doing something special for our veterans who are more elderly and maybe more alone than others. So thank you for everything you're doing. Emily Shears will be with us next from UPMC Hammett. Emily?
Hi, good afternoon. Thank you, Kathy, for inviting us once again to be part of this important briefing for the community. On behalf of UPMC, I want everyone to know that our hospital and physician offices are the safest places. If a patient requires medical care, we are here for them. While we are continuously ready to care for a surge of patients, we are also encouraged by the low prevalence of COVID-19 in the Northwestern Pennsylvania area. At UPMC Hammett, we're comfortable with our supply of masks, gowns, face shields, and gloves. On a daily basis, we are diligently screening all employees and anyone permitted to enter the hospital. For everyone's safety, we provide a mask to wear while in the hospital. Our collection site continues to see an average of 30 to 50 patients a day. Since opening March 24th, just over 3 weeks ago, we have tested almost 600 individuals and are seeing about a 3% positivity rate for the area. In our primary care and specialty networks, we continue to see 70% of our patients through virtual visits. The COVID-19 situation does change daily, so I would encourage everyone to tune in to the UPMC press conference tomorrow at 11. The link is available on our social media site. Again, we thank the entire Erie community. The amount of support shown to our faculty and members of the community means the world to us. Please know that our #1 priority is always the safety of our patients and staff. Thank you.
Thank you, Emily, and thanks for that update. You're a great partner, and we really appreciate all the work you're doing and everyone in your facility is doing for our community. Dr. Wayne Jones is our final health partner who will speak today from Allegheny Health Network, St. Vincent Hospital. Dr. Jones?
Thank you, Kathy. So here at St. Vincent, we continue to improve our facility to meet the needs of patients both with COVID and those many other health conditions that we care for here at St. Vincent. Specifically, we're working to increase our ICU capabilities. We're expanding our COVID-specific care areas and retraining personnel for areas that may be our highest demand during the surge. We continue screening and testing both our West Side Pavilion and our emergency department for patients who are concerned they may have COVID. Our supply chain does remain sustainable. Currently, we're using a peroxide sterilization technique to extend the life of much of our protective equipment. We have been providing and we continue to provide emotional support for our personnel and employees who are experiencing stress both at work and in their personal lives. We do have a deep concern for patients who are not seeking health care during this crisis. We believe they're placing their health and their lives in danger. I'll remind everybody, our offices do use telehealth, so it's like having your family doctor in your home. We do have 2 urgent care centers, one east side, one west side, and of course our emergency department, which is more central. We screen patients prior to arrival, we screen patients on arrival, and so these facilities are very safe. And so please don't feel you can't have your health care taken care of in our community. Again, I want to say thank you to the entire community, individuals and businesses, just a generous outpouring of support we've seen to our facility. So I want to say thanks one more time. Back to you, Kathy.
Thank you, Dr. Jones, and thank you for that great reminder, too, about we have to take care of our entire health and don't ignore those things that you would take care of outside of COVID-19. We don't want you to get sick in some other way. So please use the telehealth that all of these entities have available to you. It's a great tool that we are very fortunate in this time of technology to have, considering all the crisis that we're in. And now I want to open it up to the media for questions, and we're going to start today with the Erie Times News.
Hi, Kathy. It's David. Governor Cuomo earlier today announced the extension of the stay-at-home order for New York State to May 15th, indicated the other governors that are part of the group, including Governor Wolf, might be extending that. I know the Governor Wolf is speaking at this hour to the media. What have you heard? Is the stay-at-home order extended to May 15th as far as you know, and what does that mean for Erie County?
I have not heard anything about the extension in Pennsylvania, but of course, if the governor would order that, that would include Erie County because his last stay-at-home order was for the entire state. But I have not heard anything different than April 30th. Erie News Now?
Hi, a question regarding the two patients whose symptoms or cases rather seem to be linked to travel. Do you have any clue if that travel was over the weekend or just before it? Are we looking at holiday travel there likely?
I'm not really sure where that travel was at or when that occurred. But we know people have to travel for various reasons, and we know people are still coming back to our community who were gone for months. And so there's a myriad of ways that people could have been in an area where COVID-19 is much more widespread and much more community spread. And so that's why, if you can, we ask you to not travel during this time. And so I don't have any further specific information on those two people and where they went. Talk Erie?
Yes, good afternoon, ma'am. It's Joel Natale. I have a question for Emily Shears. This concept of testing keeps on coming up on my radio show. Understanding that there are two tests. There's the PCR test, which is with the swab, right, going through the nose to the back of the throat. And then there's the serology test, which is testing for antibodies, but that's not effective until 14 days after infection. So given the fact that there are people, maybe even 25% of the population, or of those infected, I should say, that are asymptomatic, what is the test for asymptomatic patients, or does that not exist?
Well, if an asymptomatic person is shedding the virus, there would be a small potential that if a PCR test or a nasal swab was inserted, it could pick up or detect the genetic components of that virus. So there is a small possibility. Right now, we're still seeing the tests are reliable for patients with symptoms. We continue to see those symptoms be fever, shortness of breath, cough, as originally indicated.
But as far as if you're asymptomatic, whether there's a test or not, there's just this tiny chance that somebody can be detected. Otherwise, the other mitigation aspects of this crisis have to go into play.
Yeah, I'm not sure I totally understand the question, but yes, right now screening is the majority of screening is directed at symptomatic patients.
Okay, thank you.
Sure. Jet TV.
Hi, Kathy. It's Samir. So I want to talk a little bit about farmers and with the waivers, of course. I know a couple farmers have reached out to me, and they're saying that a lot of their crops are kind of just rotting in the field because they don't have, employees to help field or man that. So I guess, what is your suggestion to that?
Well, I would have to go back and look at the governor's order and the waiver list, but most entities that have to do with feeding our communities, which would include farmers, were actually on the life-sustaining list. So I can get an answer from my team for you for tomorrow, but it was my understanding, that if you were growing food, if you were producing food, if you were packaging food, anything within that supply chain, that you were actually allowed to keep on working. So I don't really have a good answer for you. Erie Times News?
Yes, Kathy, I want to talk a little bit about the enforcement of the state order for masks. What are the plans right now to try to enforce this? Is this something the Environmental Task Force is going to take on hand? Can you take me through what you've talked about with your staff since the state order came down?
Right, so that order came down while I was standing here yesterday talking about masks and talking about what we were planning on doing. And so we've been talking about that. We're going to have a longer conversation tomorrow around this issue. But I think it will be similar to what we've been doing with all the businesses that have already been told to shut down or been allowed to stay open. And we would get calls into the health department, and then we would follow up, usually start with a phone call. And if a visit was needed, we would follow up with that. But we're here to help. We're here to help our businesses. I think we really need to look at this not as punishment, not as something negative, but as something positive. Because if we can show that wearing masks in these businesses that are open now, and it makes a big difference in terms of the spread of COVID-19. And I know a lot of people have been concerned about going to work because they're working for a life-sustaining business. Gosh, we maybe could think about how could we open other businesses now that aren't on that list, and could we use this tool, this thing called a mask, along with the other tools to get back to the economy rolling in our community. So I'm anxious to see, and I'm asking all the businesses out there to comply, so you can help us figure out if this works and whether this is something we can utilize to get every business back open. So look at it that way. So we're hoping that we don't have a lot of complaints, that it's mostly people calling to say, I want to comply, but I need some suggestions on how I can do this better. And that's what we would be love to answering the phone and going out and visiting businesses on that side.
And then it's not just for employees; it's for customers when they go in the store too. Correct?
That's right.
Everybody. They are required.
Yes, everybody should be wearing a mask in that business, whether they're working there or whether they're coming in the door. And even before this order came down yesterday, because we were talking about how we could encourage businesses in our community to do this, and I've talked to a few business owners, and they were like, gosh, if I could open up my business by complying with something like that, I'd be glad to do that. We obviously need more masks made, but they don't have to be fancy. You know, they can be just like this mask I made today out of a t-shirt. And this was, again, so simple. If you have a pair of scissors and a t-shirt, you can make this mask. So just something to cover your mouth and your nose. And, you know, there's great groups out there like Mask Erie and others that are making all sorts of masks. But of course, we've got, you know, 278,000 people in Erie County. And the nice thing about this video, which we have up on our website, how to make this t-shirt mask, they had a template for even little kids. So that would be helpful, because even a child coming into a business, if they need to go in, should have a mask on. They might maybe, for example, if they couldn't use telemedicine, they might have to go into the doctor or something like that. We're asking people not to take children into grocery stores, but sometimes as a single parent, you have no choice, and it'd be really want you to have your child have a mask on too. So if these businesses can help us comply with this, we think it's really a great step going forward. And we will be enforcing this in Erie County government, although majority of the government is not open to the public right now. Judge Facilla will be here tomorrow to kind of address the court situation and how we're going to handle that, because court cases are still going on, limited, but they are still happening. And every employee coming in and out of county government offices, which many still are doing, will need to have a mask on and be wearing that while they're in the buildings. Erie News Now?
Hi, a question for Ms. Shears and Mr. Jones regarding emergency rooms at AHN St. Vincent and UPMC Emmett. Wondering what you're seeing there in terms of people showing up hoping to get tested. We've just had a handful of calls of people saying that they're seeing a decent number of people there hoping to get tested, as opposed to going to primary care providers, as protocol tends to suggest you should do.
Dr. Jones, do you want to go first, since this is kind of your area of expertise?
Sure. So we are seeing patients coming in who are concerned with COVID, and we're seeing patients come in with other symptoms who aren't concerned with COVID. We do screening, and it's very standardized. We go by symptom complex, so cough, fever, malaise, shortness of breath, which we've noted before in this conversation. And there's other symptoms too. We've seen recently patients who have lost their sense of smell or sense of taste, which goes along with this illness. So there is a screening goes along with it in terms of your healthcare screening. And then we do testing if you fall into that category. So coming in and requesting it to the emergency department, you may not automatically have a test done, but if we feel that you're at risk based upon your travel or exposure screening or your symptom complex, we will do that test and follow up with you, positive or negative.
Emily?
Exactly the same. We're screening all comers that present to the emergency department for any type of medical evaluation. If they meet the criteria after being evaluated, we will make sure that they get the collection for the specimen as needed.
Would you take me through your processes? If, say, I showed up at either of your hospitals, if I showed up at the emergency room and it turns out that I was COVID positive, but I hadn't been tested yet, what would be the process there? Would I actually get inside? Would I be screened in the parking lot and sent somewhere else? Just explain to me what would happen in that situation.
Dr. Jones, you want to go first again?
At St. Vincent, when you come up, we actually meet you at your car and we ask you why you're there. If we find that your symptoms are fever, cough, sore throat, something respiratory, we will have you park and go into a tent area. And in that tent area, you'll be rescreened, either high or low risk. And then you'll be placed into area which is separate from the emergency department, but into an area where you're somewhat safer based upon your risk profile. And so you're in the proper treatment area for your needs. If you don't screen positive to any of those things, then you go into the normal area of the emergency department and have a normal entrance for your evaluation. Once we evaluate you and we determine that testing is appropriate, we will test you. We will give you instructions. Those instructions probably will say, go home and self-quarantine for at least 7 days past when your symptoms end. So you'll probably be at home for about 2 weeks. The testing takes anywhere from 24 hours to 3 days, depending on the volume and if it's a weekday or weekend. We do see some differences in how quickly we get results returned to us, but we will call you positive or negative and let you know those results. If the results are positive, we'll give you additional information on self-quarantine and follow-up. Also, just so you know, we also work very closely with the Department of Health, and if we do have a positive screen, positive test, we do notify the Department of Health, so please expect that the Department of Health will call you, and they will check to see where you may have contracted the disease, and then, of course, trace that backwards.
Thank you. Emily?
When patients present to the hospital before coming in, they are screened with a series of questions, asked to clean their hands and put on a face mask. Then they come in and are evaluated. If anyone meets any of the screening criteria in terms of symptoms that Dr. Jones had mentioned, we follow the same process. Those patients are immediately escorted to a negative airflow room. That is so that it is a safe environment in terms of if they are potential COVID, or if they've already been a known positive COVID, we would treat those patients the same. When a medical evaluation is done, the patient, if the patient requires COVID collection, we schedule that in our collection center either the same day or the next morning. It's a very fluid process that occurs very quickly, and they are given the same instructions from the state of Pennsylvania and UPMC to home quarantine, talks about what that is and what home isolation means. After they get their collection, we do call all the positive negatives, and as Dr. Jones mentioned, we do report those to the state authorities based on the county where the individual lives.
Thank you both. Appreciate it.
Thank you. Is that Erie? I'm trying to remember where I was at. I think that was Erie News Now. So talk Erie.
Yes, hi. This is a question for Monsignor Rubino. Again, a follow-up on my question last time regarding whether you're seeing an uptick in behavioral health, mental health issues at Mill Creek.
Monsignor Rubino, are you with us?
I'm sorry, I always forget to do that. Yes, Shamir, we have seen a modest uptick in terms of behavioral health and treatment of behavioral health patients. I cannot give you an absolute number, but clearly the staff has been busy seeing, talking, trying to comfort patients as they call our behavioral health units. So The answer is yes. I just can't give you a hard number.
Yeah, yes, thank you, Monsignor. It's actually Joel Natale from Talk Erie. But I guess my only other question is, what kinds of presenting issues are you seeing? I know that SafeNet is complaining that there could be higher, domestic issues going on here. But are you just seeing a lot of anxiety and fear?
Specifically, I do not.
Okay.
Now you're muted. You weren't. Monsignor Rubino, you're muted. Monsignor Rubino, are you there? Can you hear us? We can't hear you right now.
How about now?
We got you now.
Oh, I'm sorry. I keep messing this up. I apologize very much to you all. I would suspect anxiety would be high on that list, evidenced by the conference we had at the Jefferson Society 2 weeks ago. A lot of people were concerned about that, but I can substantively document that for you.
Thank you, sir.
Thank you.
Thank you.
We're all going to become experts at this technology by the time this is over. So thank you for being patient with all of us here, those who are viewing and listening. Jet TV.
Yeah, okay, it's Samir now. So my question is for the medical professionals in the room. So with the number of testing, do we feel that we're, right now in Erie County, we have an adequate number? Are we testing an adequate amount of people per day, et cetera?
Who would like to take that?
I can speak for UPMC. As we've opened it up to the county, there's really anyone that meets any of the criteria of symptoms that's had a medical evaluation or a conversation with a provider. We are providing testing to those individuals. So I think we're in a very good position right now in terms of supply and lab capabilities to be able to test anyone and everyone that has any type of symptom.
Yeah, St. Vincent has a very similar experience. Anybody who has sought out testing has been screened and tested as appropriate. So we actually have capacity for additional screening.
Does anyone else want to speak to that? The veterans?
No, and I know Mill Creek has done precisely the same.
Okay.
And at the VA,
But
it's the same
overall,
here.
do you think
Doreen?
overall do you think there could be more testing done?
Would anyone like to speak to that?
I think that if a patient feels they need testing, if they seek any type of medical care and they meet criteria, they will definitely be tested.
All right, thank you. Erie Times News?
Yes, Kathy, I want to talk a little bit about you. You were addressing county finances yesterday. I want to follow up on that a little bit.
Mm-hmm.
Do you have at least an estimated number for how much revenue the county has lost over the last month, and what is the county doing to offset those losses?
So I'm going to be speaking in just a few minutes at the Zoom meeting for County Council to give them a better picture of where things are at. But when it comes to revenue, it's really too early to know what kind of hole we may find ourselves in. And the reason is a big part of our budget is funding that comes through the state. We have not seen any changes in that funding from the state at this point, but I think we all know the state is going to have some serious financial issues to deal with as this COVID-19 crisis continues on and even when it's over. So we're not sure what that's going to mean for county government. When it comes to our revenue that we get from property taxes, our property taxes aren't due yet, and we have some property taxes coming in slowly, as they always do this time of year. Many people's property taxes are tied to their mortgage, to an escrow account, and that would be paid automatically. Of course, we don't know what this might mean for those who have lost their income and they don't have a mortgage, and they would have to pay, right out of their own bank account. And so those things we won't know, though, until the revenue, until the taxes are due and that revenue doesn't come in. So at this point, we don't have a clear picture of that, but we know that there will be issues with some of the revenue coming in. So we are, looking at a number of different things that we are going to implement. We are looking at personnel right now, and we are having, strong discussions with all of our elected officials about that issue and with our unions. And we are, going to be making some decisions here very shortly. And when we do, and our employees are made aware of that, then we will let the media know what we have decided also. Erie News Now?
Hi, one final question for you about the mask order. I know you're looking at it as really kind of an indicator and maybe a first step toward a return to normalcy. How do you gauge success of that? How do you say, hey, this is really working? What indicators are you looking at to be able to tell you?
So the second half of your question was quite garbled, but I think your question was how do we gauge whether the businesses all implementing this mask policy, the current businesses that are open, how do we gauge the success of that, I believe was your question?
Correct.
Okay. So, we're going to be looking at a number of different factors, and we need to sit down and as a team, which we are tomorrow, to really talk that through and figure out those things for our own community. I think the state's going to be giving us some guidance on that also. But what we want to see is we'd love to see days without any new cases. We'd love to say if we do have cases, we can track them exactly to where either the person traveled or they were with a known positive. We still have a few cases out there that we're struggling to find a direct source of that virus. We don't have widespread, what we call community spread or community acquired, but we know we have some. And so once, we want to see those things really end and know that we have contained the virus as best as we can. So those are the kind of things we'll be looking at, but we'll be working with our health partners, we'll be working with the state, we'll be working with just so many others, of course, the very skilled staff at the Department of Health to determine what kind of factors we're going to be looking at. How about Talk Erie? Do you have any last questions?
Yeah, one last question regarding the mask, Kathy. Again, we are, us reporters are part of the information. We're a life-sustaining business, but would you expect that in radio and television and newspaper also have to wear a mask when they're either doing reporting or in the studio, everything except when they're broadcasting maybe from...
Yes, I would expect that everyone would wear a mask when they are anywhere near other people. So if you're working by yourself, if you're in a car by yourself, or maybe just in a car with your spouse or children that you live with, you don't need to wear a mask. But if you are with other people, and this is what we're saying in county government, when you walk into the building, when you walk around the building, when you have any kind of interaction with another employee in county government, you need to be wearing a mask. If you go into an office by yourself and you're doing your work, and you could be on the telephone or whatever you're doing in your office by yourself, you don't need to have a mask on. And so that's really what we are talking about, is that everybody would be wearing a mask anytime that they are having an encounter with another person. And so, again, going back to what I've been saying, is that it's the moisture out of your nose and your mouth that can carry the virus. You may not know you have COVID-19, and you could be spreading that virus to somebody that you are talking with, and the same, they could be spreading it to you and may not know it because they may not know that they're positive. They could be one of those 25% of the people who are asymptomatic. So if we're all wearing something covering our nose and our mouth, anytime we're in the presence of another person who doesn't live in our own home with us, we believe it will do a lot and go a long way to stop the spread of this virus, and also continue to do the things that we talk about all the time, keeping 6 feet away from everyone, washing your hands for 20 seconds, using hand sanitizer, and all those other good hygiene things that we've talked about now for a month, easy. Jet TV, do you have any final questions?
I do not.
Okay, well, I want to thank everyone for being with me today, especially our partners in health, and that would be Monsignor David Rubino from LECOM, Doreen Summers from the Veterans Hospital, Emily Shears from UPMC Hammett, and Dr. Wayne Jones from Allegheny Health Network St. Vincent Hospital. They are truly our partners in this fight. They are out there every day working for all of you, and their employees truly are on the front lines, and we thank every one of them for what they do every single day to keep all of us safe. So with that being said, I ask everyone to please wear your mask, please stay home as much as you can, and to stay safe and to stay calm.